Broadcast Center in Los Angeles. This is KCAL 9 News at 7 a.m.
Well, February is National Heart Month, and we usually think of older adults when we talk heart health, but teens can have heart problems, and that can be a big problem if they're an athlete. Beverly Hospital Cardiologist Dr. Fung is here to talk about heart disease in youngsters. Good morning. Thanks so much for joining us.
Good morning, Amy.
Now, according to the American Heart Association, most sudden deaths in young athletes are contributed to cardiovascular disease. How does a parent really know if their child is at risk?
Yeah, any deaths is tragic, but death in young people who is otherwise healthy is that much more tragic. The incidence of sudden death in young athletes is unclear, but it's, thank goodness, they're rare. They're not very frequent. That's true. Most of the cases in sudden cardiac death or sudden death in young people, they are cardiac related. There are many multiple cardiac abnormalities that could lead to sudden cardiac death. But what I call final common pathway is really all these things can lead to a rhythm disturbances or heart beating so uncontrollably fast, irregular, and in fact the heart loses its ability to push blood forward and therefore cardiac arrest. Frequently these deaths are, there's no warning. But there are signs that we can look for, signs and symptoms that parents can look for.
What are those?
Most importantly, if they have exercise-induced or exercise-related symptoms such as shortness of breath or chest pain, those are things that triggers our concern. The other concern is sometimes people could have sudden fainting, or we in medicine call syncope. It's a concern as well. So when you have those, then this raises a probability that they could have cardiac sudden death. So if there is family history in particular, then one need to pay attention to, because a lot of these are genetically related. And so when you have family history of heart disease or sudden death in early age, like younger than 50, that should trigger you concern.
Okay. Now, are there special tests that the kids can take?
Yeah, general screening is a very controversial area. In America, we don't do general screening. In European countries, some of the European countries, such as Italy, they do screening with EKG. EKG is actually useful because it could uncover some of the cardiac events, some of the cardiac issues. So if the concern is high in a particular individual, then EKG would be useful. Examination by a physician would also be important because we can detect murmurs. Murmurs are irregular or abnormal heart sound when we listen to the heart. And when there's murmur, that could lead to other testing, such as ultrasound or echocardiography. So those can help us.
Are there any things that we can do as parents to minimize the risk for our children?
Well, this would be individualized, depends on the individual's risk. And high-risk individuals, such as they have structural problems with the heart or they have electrical problem with the heart, sometimes the physician will advise them to refrain from competitive sports.
Oh, okay.
But a lot of the cases can be corrected surgically or medically. Now, there are cases where you cannot. And so in those cases, you can provide a security blanket, so to speak, because as I said, it ended up with ventricular fibrillation. So what we can do is to put a defibrillator internally, called ICD. So when a person develops these rhythm or these irregular heartbeat, then the ICD can shock the patient and bring them back to normal rhythm.
Okay, well, all right, doctor. Thank you so much for joining us this morning. We appreciate all of the information. Now, if you have, you'd like more information about heart health or to watch this segment again, just go to our website, kcal9.com, and click Seen on TV. We'll be right back.